today and all the advocates behind them for standing up for the idea that California is not going to stand for the assault on reproductive freedoms that we have seen elsewhere in our country. In our state, we have made sure that we will not only protect access to reproductive care, but we're going to work hard to expand that access. I'm going to take a moment to speak about our bill, AB 1184. This is a bill that will protect patient privacy and at the same time expand access to healthcare. The law will establish an automatic right to privacy for patients who access sensitive services. The reason we've needed it is at this time when a patient is on someone else's health insurance, such as a parent or a spouse, there has unfortunately been a real risk that insurers send communications about sensitive health services, such as reproductive care, gender affirming care, substance abuse care, mental health care, to the policyholder instead of the patient. And for young people accessing reproductive care, for that transgender youth accessing gender affirming care, for a domestic violence survivor, this violation of privacy has put them in a terrible and in some instances an even dangerous position. AB 1184 says that if you're receiving sensitive health services, only you should get confidential communications about it. No one else, period, end of story. Fundamentally, this bill will ensure that patients do not forego medical care they need because they're worried that their privacy might be violated. I want to thank Planned Parenthood, our coalition of reproductive rights, healthcare, LGBTQ, and civil rights organizations, my colleagues, our amazing leaders, and of course, our governor for getting us here today and protecting patients, and our work continues. And with that, I'm honored to turn the mic over to my great colleague, a real champion for reproductive freedoms, Assemblymember Rebecca Bauer-Cahill.
Thank you, Assemblymember Chu. It's an honor to follow you. You've been in this fight for a long time, and thank you for your continued advocacy. I am so honored to be here today with Governor Newsom, our legislative leaders, the Pro Tem and Speaker, and our partners at Planned Parenthood to stand up and say loud and proud that California will continue to be the champion for reproductive rights, for maintaining California as a beacon for women's freedom to choose and to do so safely. Like many women, we've spent the last decade worrying that our fundamental right to privacy, as ensured in Roe v. Wade, would be taken away from us, that we would no longer be able to control our own futures and our own bodies. And just recently, we all saw exactly that happen to the women in Texas. And today we stand as Californians and as leaders in this state to affirm that we will continue to do everything we can to lead the nation in ensuring that women continue to have safe access to comprehensive reproductive health care, including abortions. You heard Assemblymember Chu speak about how there are continued risks, even here in California, to those seeking reproductive health care. Obviously, unplanned pregnancies and unsafe abortions are risky for women, but so are these continued risks in California, including the information breaches that Assemblymember Chu worked so hard to ensure would no longer be the case. And so I want to tell you a little about AB 1356. It's a bill that I'm incredibly proud of and excited to see become law today, because it will protect our patients and our reproductive health workers at the clinic doors. Not only did the Supreme Court take away the rights of women in California, but they emboldened extremist groups who show up in California all the time. In my own district, in Assembly District 16, we see it every single day. And they threaten our patients and our providers, and they ensure that some patients don't receive the care that they're there to receive. And so with AB 1356, we are upping the ante. We're saying in California, we will not accept that our reproductive healthcare providers and patients be subject to threats, both online and in person, that we will protect them. We will train law enforcement to protect our patients and providers, and we will punish those who commit these crimes. And so this is an important step for everybody who is accessing reproductive health care and providing it here in California. And so I'm so excited today that, Governor, you will be making California safer for all of those providers and all of our patients in California. And I want to thank our incredible partners at Planned Parenthood, all the legislators who supported this work, and the coalition that made it happen. But I mostly want to thank our providers who have continued through all of these threats to provide the care that women in California needed. And know that today we're making you safer, and we will continue to do everything we can to ensure safe and comprehensive access to reproductive health care. Our hearts go out to everyone in Texas but know that we will continue to fight for you in every way we can. Thank you. And with that, I want to turn it over to our incredible partner on all of these pieces of legislation, Jody Hicks, who is the CEO of Planned Parenthood Affiliates California.
Thank you. Thank you so much, Assemblymember Chu, Assemblymember Bauer-Cahan. Thank you on behalf of the advocates, on behalf of the providers, on behalf of all of the healthcare workers, mostly on behalf of all the patients trying to receive care, and your leadership and being strong champions for sexual and reproductive health care. We just deeply, deeply appreciate you authoring these bills, and Planned Parenthood was so proud to sponsor them. And thank you, Governor, for being a reproductive freedom leader and a champion for sexual and reproductive health care, and for all of the leaders here for showing leadership at a time when there's so many attacks restricting rights and access to care right now. So I'm just honored to celebrate the action being taken with these two bills at a time when the rest of the country is looking to ban access to care. We in California continue to expand access to care. It's really an inspiration, and we're, as Californians, a great example of how we should be treating patients. And the bills being signed today just build upon California's status as we proclaimed California as a reproductive freedom state. These bills are certainly a step in the right direction, and this legislation will ensure that our providers, our healthcare workers, our patients can provide and receive care without being harassed. They can ensure their privacy is protected, and ultimately, to me, these bills are really about dignity and people receiving care with the dignity that they deserve. And you know, I just can't thank you enough. We're going to continue to look to increase access and health equity here in California. So with that, I'm honored to hand it over to Governor Newsom to sign these pieces of legislation and to lead in this space. So thank you again.
Well, I appreciate you, Jody, and thanks for just your steadfastness, your commitment, your devotion to this cause. It's what happens when I have no staff. It's what happened, you know, ever since the legislature left town, they left me alone. So I'm here trying to find paperwork. But I'm proud to have found these two bills, a stack of about 800 bills that we are working our way through, because these are profoundly important. And I want to just express my gratitude to the authors, and I appreciate some members, you hard work, your commitment to this cause. And I absolutely appreciate this cause predates just the cause that unites us here today in terms of your efforts to be fierce advocates for reproductive rights. And so I'm just honored in, to extend that narrative by signing 1184 and 1356. But also, I'm also mindful of what David just said and some member Chu said. These are dark days. I don't think one can understate the consequential nature of the moment that we're living in. Jody came in a few months ago really to highlight that, to bring more contemporary knowledge to bear when she and others sat down, me and folks from NARAL and others that helped organize the efforts around these two bills, to really remind me of what's going on across this country. And this was even before the formality of what occurred in Texas and what is, of course, taking shape all across this country in a few dozen states. I'm reminded, and we should remind ourselves, that we have these trigger bans that are in place if, God forbid, Roe is overturned. And of course, that will be adjudicated later this year in the Mississippi decision. But those trigger bans can impact almost 60% of women and girls of reproductive age, 58% to be exact, live in these states with these trigger bans. And so it becomes of outsized importance that California assert itself. Take nothing for granted. Good enough never is. We've got to continue to step up our efforts to do, dare I say, just the opposite of these states like Texas. And that's what we're doing here today, is we're reaffirming the constitutionally protected and fundamental rights of women to have these safe and accessible reproductive and sexual health care that they deserve, that they are rightfully afforded, and to do so with the dignity, as Jody said, that they deserve as well. I love that Jody, just this notion of dignity, because this is hard. This is a hard topic. It's a hard subject for everybody. But this notion of dignity is profoundly important. And I'm glad that's center in this conversation and certainly a big part of what 1356 and 1184 do. Thank you for this notion of right to privacy, that fundamental notion, and it extends even beyond just reproductive care. And I appreciate gender affirming care and all the components of this bill that will be advanced with this signature, but also just notion of protect and making sure protecting people and making sure that people, again, are afforded that dignity throughout that experience and that decision making. I'll just end by also making one point that can't be repeated enough, and that's the number 231. That's seared in my mind. Those are the number of federal judges that the Trump administration appointed. 231, mostly white and young conservative judges that were vetted by groups that are united in their opposition to the principles that we are trying to advance here today. So we can't take this moment for granted. We have to remain vigilant. And I'll just end by expressing gratitude to the two leaders that are also assembled here today, Speaker Rendon and of course, Pro Tem Atkins, who have been consistent in their leadership and their advocacy, not just publicly. Pro Tem, in fact, just was in the office last week, just doubling down on this subject matter, saying we have to do more, we have to do better. And I am not surprised the two of them are here with us today, because they've been with you, all of you, from day one in terms of this journey we're on to advance the rights of women and girls. So thank you to the two leaders. Thank you to the two remarkable Assembly members for all your hard work. Thank you for the privilege of being able to sign these two important bills at this incredibly important time in our nation's history. And let me just say this, we recognize we have more to do. And I'll just close by thanking all of you that are assembled for organizing this new working group, this task force, to hold us to a higher level of expectation and accountability as well. We're going to do everything in our power to support you through that effort. But let's just get to why we all came, and that's to get these signatures done and to make sure that these bills go into effect at this critical time. Thank you, all of you. 1184, 1356 are now signed into law in the state of California.
Great. And of course, Governor, we have, as you alluded to, the state's leadership here who want to talk a little bit how we're moving forward with some announcements that were made this morning. So we'll turn it over to Senate Pro Tem Atkins.
Well, thank you, Governor Newsom, for signing this legislation, and thank you all for the opportunity to join you today. I come to this issue with a background in the field of women's health, so I wanted to share a little bit of my experience with you today. I was a director of clinic services at a women's clinic in the 80s, the mid 80s. And in that time, I saw exactly what access and lack of it meant for women. As our San Diego clinic progressed, we helped women from Mexico and other states with restricted access. And I saw the devastating emotional and financial impact that it had on them and their families. I met mothers who had lost their daughters due to illegal abortions. I held the hands of women as they considered their options, and I supported these women. Court rulings like the one we saw in Texas just a few weeks ago, and cases like the Mississippi one that the Supreme Court announced it will hear in December, aren't just legal proceedings. They stand to have a daily impact and a very real impact for women and their families across this country. As we look carefully at what it means for California, I remain committed, like my colleagues, to protecting reproductive rights and a woman's right to make decisions about her own body and access healthcare services that she needs. I'm proud to partner, as always, with Planned Parenthood affiliates of California in convening a team of experts to reinforce California's critical role in offering sexual and reproductive health care, including abortion. This team will include researchers, advocates, elected officials, providers, patients, and key constituents, and will collaborate with pro-choice and sexual reproductive health care allies and leaders to determine potential challenges that may rise up and to figure out solutions so that we can continue to provide stability and sanctuary for California women and those who may seek services here. California has been a beacon of hope for women, and we are determined to keep it that way. And now I want to turn it over to my legislative partner and another leader in California's efforts to uphold and protect women's health care and access, to my friend and colleague, Speaker Anthony Rendon.
Thank you. Thank you very much. There are a lot of people to thank for this moment. I think we should definitely start with Governor Gavin Newsom, not only for his leadership on this issue, but for his leadership on so many other important issues that are incredibly important to the state and that really shine a light on the leadership of California. So definitely thank you, Governor Newsom. From the Assembly, I want to thank my colleagues, both legislative superstars, David Chu and Rebecca Bauer-Cahan. Thank you, both of you. Tremendous amount of work went into both of these pieces of legislation. Today is the culmination of that. But your efforts are going to be incredibly important and have a tremendously important impact throughout this state. So thank you. Of course, my colleague, Tony Atkins, my partner in the legislature, Senator Atkins and the House that she led, fought hard to make sure that these pieces of legislation went through the process and were approved by the Senate. So thank you. Senator Atkins, for your friendship, for your leadership, and for all that you did to make sure that these two bills came out of your house. We also want to thank the advocates. I want to thank the advocates. I know they've been thanked, but we can't say enough for the advocates who continue to bring our attention to the issues of reproductive freedom, particularly at this moment. Without that advocacy, it would be difficult for California to continue to stand fast on reproductive rights. It would be hard to make sure that we continue to protect and advance those freedoms that are intrinsic to a person's right to control of their own body. Beyond that advocacy, however, we have to thank the people of California. It is the people of this state who have continued to elect leaders such as the ones we've heard of, legislators and executive, who reflect our state's diversities and who support the principles embedded in these two new laws. We must continue to preserve the privacy and medical confidentiality of the patients who pursue reproductive care. I'm sure I don't need to remind anyone, and it's been brought up many times today, that those rights are under assault in a lot of places throughout our country. While brave patients and providers in Texas and elsewhere stand up to attempts to erode those rights, we in California owe it to them to hold the line. We owe it to them to continue the work that can serve as a model. These new laws represent that model. So once again, I thank everyone who brought us here. And now I'm happy to introduce Jessica Pinckney, the Executive Director of Access Reproductive Justice.
Thank you so much, Speaker Rendon. Access Reproductive Justice is honored to be here today for the signing of this important legislation and the announcement of the California Future of Abortion Council. All efforts to improve access to reproductive health care, especially abortion, are always necessary, and particularly in this moment. Reproductive justice, the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities, is critical for all Californians, particularly Black, Indigenous, people of color, transgender, and gender non-binary folks, and other historically marginalized communities. We commend Governor Newsom, Pro Tem Atkins, Speaker Rendon for their leadership in ensuring that we protect access to abortion for Californians and those coming into the state to access care in light of the ongoing and recent threats to abortion access across the country. As a reproductive justice organization, funding abortion and providing practical support such as travel, lodging, childcare to people accessing abortion throughout California and those coming here to California to access care, We know how crucial bodily autonomy and decision-making power is to our callers and our community. We are committed to doing everything in our power to ensure people have access to abortion and other reproductive health care as they need it, because restrictive laws do not get to determine the futures we have for ourselves. We do. Access is grateful to our fellow advocates and the legislature for their commitment to ensuring California maintains its reputation as a reproductive freedom state. And we look forward to centering the experiences of our callers seeking abortion care and support in this effort moving forward. Thank you so much. And with that, I will pass it back to our fellow advocate, Jody from Planned Parenthood.
Thank you so much. And I just can't thank everyone here enough. And I think the speaker said it best in starting this about it has been some dark days. And we've all felt that with happening with Texas. We know that now we know December 1st is the Mississippi case. And it's hard not to be, angry right now, quite frankly. I think we were sad going through what happened with Texas, and then it's hard not to be angry to watch what's happening in other parts of our country. But what I always love about California is we take that anger and we turn it into action, and that's what we're doing here. California has constitutional protections, and we could sit back and be safe here in California, but that's not what we do. And so I'm just excited and proud that we're launching the California Future of Abortion Council. We know already we're seeing a handful of patients a day since what happened in Texas. We know what's happening in the rest of the country, and that will continue to go up. I want to ensure that we're thanking all of the reproductive justice partners that ensure that people are safe here in California, but are also participating in this effort to make sure that one of our exports is to be this sanctuary state where we can ensure other people are able to receive services should they need it. I'm going to list them off, and if I miss some folks, we thank you all as well. There's so many people, but Access Reproductive Justice, Black Women for Wellness Action Project, NARAL, Pro-Choice California, National Health Law Program, Equality California, Essential Access Health, the Commission on the Status of Women, and so many others that will participate. We'll have provider groups, but really what we're looking at with this is ensuring that this is patient-centric, that we're really looking at a world in which we're ensuring from start to finish patients are able to receive services, and what are all of those legal, legislative barriers that may exist, and that we're getting together in a room and ensuring that we're coming out of this with a goal of really a blueprint for how California can be a reproductive freedom state, and we can find solutions to any of those. I think this is historical. I feel for my colleagues in Texas right now that are grappling with how they can help patients. And I love the fact that we can be some level of hope that we're going to help for patients in this coming year. And this California FAB Council really comes at a critical time. We know what the recent attacks have been and continue to be, and California will continue to strategize. We're looking at policy, legal, advocacy, everything we need to do to ensure we're expanding access to care. So with that, I just want to again express so much gratitude, inspiration. It really is something that we're coming together in this way to ensure that we're not just taking care of ourselves, but we're looking at that too for what's happening here in California, but how we're ensuring patients are safe, and that as we have a commitment to equity, to public health here in California, that we know reproductive and sexual health care is a part of that, and we're ensuring that that's true for everyone. So with that, I'm going to kick it back to the governor for closing remarks, but just huge thank you, and can't wait till we're in person and giving you all a hug. Thank you so much.
No, I appreciate it. Jody, I think you did a wonderful job summing up, and thank you for recognizing all the incredible partners that are assembled here, not just today, but organized around supporting these bills. And I think the speaker is absolutely right. None of this happens without that incredible support from the outside and encouraging all of us to do the right thing in terms of our respective roles and our responsibilities. So we recognize that we have more work to do. And we recognize what's at stake, particularly as you said. I mean, the fact that this is now scheduled December 1st, it takes a whole new meaning after what just occurred in Texas. And so do these two bills that I was honored to sign here today. And so to everybody, thank you for your extraordinary leadership. Thank you for the privilege again of having the opportunity to sign these two bills. We look forward to reconvening, and we look forward to doing more and doing better as a state to truly stand tall as that reproductive freedom state that we have so proudly defined our state to be. Thank you all very, very much for being